ओम धम धन्वंतरे नमः। कर्पूरगौरम करुणावतारम संसारसारम भुजगेन्द्रहारम सदा वसंतं हृदयारविंदे भवं भवानी सहितं नमामि। So today's topic is Dextrocardium, situs invertus, cartaginous syndrome, and eventration. The X-ray study. Actually, the heart lies in the left side of the chest. Left side in the chest. And the apex cardiac base is directed in the right side, and apex cardiac apex is directed to the left side, present to the left side of the chest. But in some condition, in congenital disorder, the heart lies in the right side. That means the cardiac apex will be present in the right side. It is known as dextrocardium. Dextrocardium. So when dextrocardium is assisted with the abdominal structures like stomach in the right side and liver in the left side, it is known as situs invertus. Dextrocardium is situs invertus. And in some patient conditions, there will be dextrocardium, situs invertus, and also there will be some compulsory changes in the lung parenchyma, which will show bronchiectasis. If these three is there, dextrocardia, situs invertus, and bronchiectasis, it is known as cartaginous syndrome. And eventration is a condition where there is congenital defect of the diaphragm, so, which will lead to the abdominal contents will be protruding into the thoracic cavity, thorax. So you can see the intestinal coils inflated with that. Their shadow will be present in the thoracic cavity. That is known as eventration. Here you see the exercise behavior of a person, patient. So you can see the cardiac apex is present in the right side of the chest. So heart is situated in the right side of the chest instead of normal left side of the chest. It is known as dextrocardium. Dextrocardium. So the heart is situated in the right side. Cardiac apex is present in the right side. This is another X-ray which shows dextrocardia. You can see the heart shadow is present in the right side of the chest. You can see the cardiac apex is situated in the right side. And also you see beneath the diaphragm, right hemidiaphragm, there is air shadow. That is due to the presence of air in the gastrium or stomach. So stomach is also present in the right side. That is known as situs invertus. It is a congenital disorder. So here you see situs invertus is not there, isn't it? The dextrocardium is there, but the gastrium shadow or stomach shadow is in the left side. So the cardiac apex is shifted, is present in the right side. Heart is in the right side. Bronchovascular markings are prominent, but the gastrium or stomach shadow, air shadow, is in the left side. This is the condition of dextrocardium, the absence of situs invertus. Here you see This is a condition where dextrocardium is also there, situs invertus is also present. You can see the heart shadow in the right side of the chest, cardiac apex is in the right side of the chest, and beneath the right hemidiaphragm there is the air fluid level, that is the stomach shadow. So stomach is situated in the right side instead of left side, and liver is situated in the left uh, left side. So this is a condition where this dextrocardia with situs invertus. However, you can see the aortic knuckle is also on the right side. It is prominent. This is another X-ray. It shows heart shadows on the right side and stomach shadow in the left side. This is dextrocardia without situs invertus. You can see the hilar shadows are prominent. The heart cardiac apex is present in the right side. Liver in the right side. This is a normal position. And stomach shadow, stomach air shadow is in the left side. This is a condition of dextrocardium without situs invertus. Here is the dextrocardium with situs invertus. You can see the heart shadow in the right side, cardiac apex in the right side, and stomach shadow also in the right side. You can see air fluid level in the stomach is in the right side, and liver instead of right side, it is present in this patient in the left side. This is condition of dextrocardia with situs invertus. You can see dextrocardium without situs invertus. The stomach shadow in the left side is a normal position. You can see the heart shadow in the right side. The hilar shadows are prominent, and stomach hair shadow is in the left side. The condition, the female patient breast shadow is also there. The condition with dextrocardium without situs invertus. This is the patient of dextrocardium with situs invertus. You can see heart shadow in the right side, the cardiac apex in the right side, and stomach air bubble is in the left right side. Instead of stomach shadow in the left side, here stomach shadow is in the right side, liver shadow in the left side. Just the reverse. This is the condition of situs invertus. So dextrocardia with situs invertus. Here you see the heart is situated in the right side. This is a dextrocardium. The stomach is situated in the right side. Dextrocardium with situs invertus. Liver shadow is seen on the left side. Here another patient with the X-ray of dextrocardia with situs invertus. You can see the cardiac apex on the right side. Heart is situated in the right side. And stomach in the left right side. It is air bubble in the stomach is seen, air shadow in the stomach is seen in the right side. So situs invertus. Here you see another patient of dextrocardia with situs invertus. You can see the heart shadow in the right side and cardiac apex situation in the right side. Stomach shadow, there is air shadow is there, that is in the right side. The normal position is left side. Here situs invertus. The liver situated in the left side. Another patient, you can see the dextrocardia with situs invertus. And also some bronchotasis changes are seen. There is a condition of dextrocardia, situs invertus, and cartaginous syndrome. When dextrocardium and situs invertus are present, also there is comorbidity like bronchiectasis. The condition is known as cartaginous syndrome. You can see the cardiac shadow in the right side, cardiac apex in the right side. So, it is a patient of dextrocardia. Here you see artifact is that the heart shadow is situated in the right side, cardiac capacity in the right side, stomach bubble aromatous in the right side, and there is bronchitis changes. This is a condition known as cardiac syndrome. Cardiomegaly with dex- dextrocardia with situs inversus and bronchiectasis is known as cardiac syndrome. You can see the heart is in the right side, cardiac apex in the right side, the other shadows are prominent, stomach shadow in the right side, liver shadow in the left side, and bronchiectasis is a case of cardiac syndrome. You can see here also cardiac syndrome. Okay. So there is the heart shadow in the right side, cardiac apex in the right side, stomach shadow in the right side, and liver shadow in the left side. There's some bronchiectasis also there, the condition of cardiac syndrome. You can see here. Okay. So cardiac syndrome. The heart is in the right side, stomach is in the left side, right side, liver in the left side, bronchiectasis changes. Here also, so is a female patient, breast shadow is prominent. You can see heart is in the right side, apex is in the right side, stomach shadow, air shadow is in the right side. Bronchiectasis changes. This is a patient of cardiac syndrome. This is another patient showing X-ray of cardiac syndrome. So heart shadow on the right side, cardiac apex on the right side, stomach shadow on the right side, liver on the left side, bronchiectasis changes. This is another patient of cardiac syndrome. You can see the cardiac apex on the right side, the stomach bubble in the right side, liver in the left side, and bronchiectasis changes. Another patient of cardiac syndrome. You can see the cardiac apex in the right side, stomach bubble in the right side, liver in the left side, and bronchiectasis changes. Patient of cardiac syndrome. Here it is very clear, isn't it? Bronchiectasis changes are there, very prominent, and cardiac apex in the right side, and stomach shadow in the left side, heart shadow in the right side, and bronchiectasis changes. Very clear cut case of cardiac syndrome. Here also you can see the cardiac apex is in the right side and stomach shadow in the right side and liver in the left side and bronchiectasis changes. The case of cardiac syndrome. Here the bronchiectasis are very common, isn't it? And the stomach shadow is in the right side. Cardiac apex in the right side. This is a case of clear-cut case of cardiac syndrome. Here you see bulging is there. The cardiac apex in the left side, but bulging in the right side. This is the eventration. You can see the colon is inflated, and it is the shadow of the colon is seen in the lung thoracic cavity. This is because of laxity of the hemidiaphragm, left hemidiaphragm. The abdominal content is protruding into the lung thoracic cavity. This is known as eventration. You can see colonic air shadows in the right thorax, left thorax. Okay. Here is in the right thorax, there is the stomach air shadow, and abdominal contents are seen in the thoracic cavity, right thorax, right thorax. This is a case of eventration. This is because of laxity of the diaphragmatic muscles. Another case of eventration, you can see the colonic, the hair shadow in the colon in the thoracic cavity, left side, isn't it? This is a case of eventration. This is a congenital condition where there is a laxity of the diaphragmatic muscles. eventation. Another case of eventation, you can see the stomach contents in the thoracic cavity, the left side. You can see that it is a case of eventation. You see the right side, the the abdominal content is seen in the thoracic cavity. This is another case of eventation. Stomach shadow is seen in the right thoracic area. Sorry, colonic shadow is in the right colonic area, right thoracic area. This is a case of eventation. So if you see left side, the air shadow of the stomach is present in the thoracic cavity. Left side, isn't it? The case of eventation. See, in this X-ray, the left thoracic cavity, there is the abdominal contents penetration, isn't it? So this is a case of eventation. So today we have discussed the conditions, the X-ray of study of dextrocardia, situs inversus, and cartagena syndrome and eventation. Thank you for patient hearing.